Welcome, everybody. It's another Friday, and so it's another episode of Ask Me Anything, your Q&A live, Ask a Therapist. So I'm Elaine Belson, and I've been a psychotherapist for 30 years. And today I'm going to talk about therapy and why everybody needs it. But first, let me remind you that this is a live feed, but it's being recorded. Advice given on this show is for informational purposes only and is not intended to replace professional, psychological, or medical advice, diagnosis, or treatment. Questions and concerns about your mental health should be discussed with a qualified professional. Any use of this information is the sole responsibility of the listener. If you're having thoughts of harming yourself or someone else, call 988 or go to the nearest emergency room. So, today I'm going to answer the question, do I need therapy? The answer is everyone does. You don't know what you don't know. What if I told you you don't need to worry ever again? You have the instincts to make good decisions, that arguing is avoidable, that no matter how alone, inadequate, or misunderstood you feel, you're not. People are more complicated than they give themselves credit for. If you weren't, you would have figured out all your problems by now. But that's where a therapist comes in. I want to talk first of all about the stigma of mental health. As a psychotherapist, I'm used to the skepticism, even ridicule of mental health. In fact, no one understands your reluctance more than I. But when you ignore your mental health, you're rejecting yourself. You're wandering through life, avoiding the essence of who you are. Do you have any idea how self destructive that is? Not for you just individually, but for society. Mental health is as vital to your existence as physical health, but cultural norms have prejudiced us to place greater value on one over the other. Why does our society compartmentalize mental health? We don't do this with physical health. We don't equate the word medical with disorder. We don't discourage people or shame them for seeking medical care. We don't tell people that they should be able to treat their physical illnesses without medical intervention. And we don't assume we know as much as medical specialists. Yet these are all things we do with mental health. So let's talk a little bit about what mental health is, right? And when I talk about mental health, I'm not just talking about the um, clinical diagnosis that we're used to hearing about, like depression, anxiety disorders, PTSD, OCD, and substance abuse disorders. I'm talking about everyday types of struggles, such as worry, low self esteem, relationships, communication issues, parenting, work life balance, chronic pain, anger management, life transitions like job, divorce, retirement, moving. Um, in that regard, you should think of a therapist like you would your primary care manager. When a physical problem arises, you go to a medical provider. Well, when a life problem arises, you should go to a therapist because they are uniquely trained and experienced to help in three ways: through insight, which I call the seed for change, problem solving, and then learning new coping skills. One of my mantras is, if information and reason was enough to change minds, no one would ever speed on the highway or eat junk food. In other words, it's just human nature, right, to do things even though we may know that they're not always good for us and they may not make sense. But that's why it takes insight, which I call the seed for change, problem solving, and learning new coping skills in order to change. And that is something that you can't think for somebody. You can't do that for somebody. You've got to facilitate or help them to gain that insight and to do the problem solving. and then teach them new coping skills that they don't already know. One of the things that I hear all the time from people is that they feel like they're weak if they're going to therapy. And in reality, it's just the opposite. For one thing, we have feelings for the same reason that we experience pain and hunger. Feelings are information of a need or a threat that we're overlooking. So if I touch a hot stove, I'm going to feel pain in my hand. And there's a reason for that. If I didn't, then I would burn my hand, right? And so it would damage it. If I don't eat for days, I experience hunger because if I didn't, I could starve myself to death. So we have uncomfortable feelings for the same reason, right? They are a survival mechanism to help us to make good decisions. And so what we want to do is we want to tune into those feelings instead of what most people do, which is to talk themselves out of their feelings, right? Or to bottle them up. And so most of what you're going to do is you're going to be reacting to your emotions, right? Rather than being proactive. So when you take the time to acknowledge your feelings, right? And then identify where specifically they're coming from, and then problem solve what's in my control, right? That's how you make good decisions. So, for example, if if I'm um, anxious about taking an exam, right? If I take the time to ask myself, what is it specifically that I'm afraid could happen? Um, I might be afraid that I'm going to forget the information I studied. I might be afraid that I'm going to have a panic attack in the middle of the exam, or I might be afraid that I don't understand the questions, or I might not know how to take the test. So, depending on which of those things I'm anxious about, that's going to determine what my intervention is. If it's that I'm afraid of forgetting the material, then I would work on my study skills and how best to retain information. If it's that I'm afraid of having a panic attack in the middle of the exam, well, then I would look at um, what are some relaxation techniques and some ways of keeping myself from getting overwhelmed by my anxiety. If it's I'm afraid I won't understand the questions, then I can review previous exams and what questions I got wrong and how I might have answered them differently. I might go to the teacher and ask them if I could talk to them about some of the questions I got wrong and why. I actually did that when I was in college myself. So, and it helped. So, so that's why it's important to be proactive with your emotions, to acknowledge them, to identify where specifically they're coming from, what's making you feel that way, and then what's in your control. Otherwise, what you're going to do is you're going to be reactive. You're going to not take the time to identify what specifically is causing the feeling, and then you're going to make decisions in the moment, and it's when we do that that we make bad decisions. And in fact, most people go through life reacting to feelings that they're not even conscious of. And so, again, that's why we have feelings. It's to get us to be proactive, right? Each feeling tells us something. It tells us that we're either feeling out of control about something, or that we're feeling overwhelmed, or we're feeling hopeless or helpless, or we're feeling threatened in some way, depending on what the feeling is. And so, those feelings are like your red flag. They're telling you that there's a need or a threat that you are overlooking, and they're there to energize you and to motivate you to do something about it. And I hear all the time from people that, they think of therapy as a weakness or that they should be able to solve their own problems. And what I'm telling you is that you don't know what you don't know. And there's a lot of things that people don't realize about therapy and what it really is about. It's about much more than giving advice. In fact, don't give advice. I empower people to make good decisions. For one thing, you don't need me giving you advice. There's already plenty of people in your life doing that. Um, and you don't need me to be hard on you because you're already hard enough on yourself, right? And so, the one thing that I can do though is facilitate you identifying what you're feeling, where is it coming from, and to help figuring out the answers. And then what I can do is provide you with some coping skills that you don't already know. Skills and training and experience that therapists have that are unique to our field. And many people, I would say that, people that I have worked with who are felt self-conscious about coming to therapy and thought of it as a weakness, once they started and they saw how much it helped them, felt differently about it. So, and again, you don't know what you don't know. So if you don't try it and you don't see what it's like, you have nothing to compare it to. So I'm going to stop for now. Remember to click the bell and subscribe so that you get notified next Friday noon for the next live question and answer. And you can also learn more about me and listen to more podcasts at elainebelson.com. Have a good weekend. See you next time.